Good day, everyone. So today we're going to discuss about first aid for choking. So when does choking occur? Choking occurs when a foreign object is lodged into the throat or windpipe, blocking airflow. The common culprit for adults is food, and for young children, small objects. It is important to give first aid as quickly as possible, since choking cuts off the oxygen to the brain, which may cause unconsciousness or even death. The universal sign for choking is hands clutched to the throat. But if a person is suspected of choking, does not give this signal, other indicators may be present. So first, inability to talk. Second, difficulty breathing or noisy breathing. Third, squeaky sounds when trying to breathe. Fourth, cough that may either be too weak or forceful. Next, skin, lips, and nails turning blue or dusky. Next, skin that is flushed, then turns pale or bluish in color. And lastly, loss of consciousness. There are many different situations in which choking may occur. We will now list down the possible circumstances and their appropriate responses. So first, for adults, it is recommended to give a 5 and 5. So what is this? So first, give 5 back blows. Bend to the side and behind of a choking adult. And for a child, kneel down behind them. Be sure to place one arm across the person's chest for support and bend the person over at the waist so that the upper body is parallel to the ground. Deliver 5 separate back blows between the person's shoulder blades with the heel of your hand. Second is give 5 abdominal thrusts. Perform 5 abdominal thrusts or the Heimlich maneuver. And lastly, alternate between 5 blows and 5 thrusts until the blockage is dislodged. So to perform the Heimlich maneuver, first, stand behind the person. Place one foot slightly in front of the other for balance. Wrap your arms around the person's waist and tip the person slightly forward. If a child is choking, kneel down behind the child. Second, make a fist with one hand. Position it slightly above the person's navel. Third, grasp the fist with the other hand. Press hard into the abdomen with a quick upward thrust as if trying to lift the person up. And lastly, perform between 6 and 10 abdominal thrusts until the blockage is dislodged. Next, if you're alone, you are to perform the Heimlich maneuver on yourself. First, if you're alone and choking, call 911 or any local emergency number immediately. Next, place a fist slightly above your navel. Then grab the fist with your other hand and bend over on a hard surface. A countertop or chair will do. Then shove your fist inward and outward, and repeat until the blockage has been dislodged. For pregnant women and obese persons, first, position your hands a bit higher than the normal Heimlich maneuver. It is to be placed at the base of the breastbone, just above the joining of the lowest ribs. Then, proceed as with the Heimlich maneuver, pressing hard into the chest with a quick thrust. And lastly, repeat until the food or other blockage has been dislodged. If a person becomes unconscious, please follow the next few steps.
It is necessary to clear the airway of an unconscious person through the following procedures. First, lower the person on his or her back onto the floor, arms to the side. Next, clear the airway. If a blockage is visible at the back of the throat or high in the throat, reach a finger into the mouth and sweep out the cause of the blockage. Don't try a finger sweep if you can't see the object. Be careful not to push the food or object deeper into the airway, which can happen easily in young children. Proceeding, to clear the airway of a choking infant younger than age 1, it is necessary to do the following steps. First, assume a seated position and hold the infant face down on your forearm, which is resting on your thigh. Support the infant's head and neck with your hand and place the head lower than the trunk. Next, thump the infant gently but firmly 5 times on the middle of the back using the heel of your hand. The combination of gravity and the back blows should release the blocking object. Keep your fingers pointed out to avoid hitting the infant in the back of the head. Then, turn the infant face up on your forearm, resting on your thigh, with the head lower than the trunk, if the infant isn't still breathing. Use 2 fingers placed at the center of the infant's breastbone. Give 5 quick chest compressions. Press down about 1.5 inches, and let the chest rise again in between each compression. Repeat the back blows and chest thrusts if breathing does not resume. Call for emergency medical help. Begin infant CPR if one of these techniques opens the airway, but the infant does not resume breathing. It is important to take note that if the child is older than age 1 and conscious, give abdominal thrusts only. Be careful not to use too much force to avoid damaging ribs or internal organs. As a general reminder, if you are in doubt about what to do and you are witnessing someone choking, call for emergency help immediately and do not delay. You may be able to successfully stop the choking before help arrives as discussed here, but it is best for the choking person to be evaluated by the emergency medical team when they arrive. If something is still in the person's throat, the emergency medical team can begin care immediately and take the person to the hospital for further treatment.